Constant fatigue. It's the most ignored warning sign in modern medicine. People treat it like a personality trait. It isn't. Your body is telling you something is broken. Most people just drink another coffee and keep moving. The first hidden cause is hypothyroidism. Your thyroid gland controls energy production in every cell of your body. When it slows down, you slow down. The American Thyroid Association estimates that 20 million Americans have thyroid disease, and up to 60% don't know it. The most common symptom: fatigue that never goes away. The second cause is iron deficiency anemia. Your red blood cells can't carry enough oxygen to your muscles or brain. The CDC reports that nearly 10 million Americans are iron deficient. Most are women under 50. Most have no idea. But the deadliest cause is sleep apnea. Your airway collapses during sleep. Your brain wakes you up, sometimes hundreds of times a night, without your awareness. Studies estimate that nearly 1 billion adults worldwide have sleep apnea. Untreated, it doubles your risk of heart attack, stroke, and sudden cardiac death. Then there's chronic fatigue from autoimmune disease, lupus, rheumatoid arthritis, multiple sclerosis. All start with one symptom: exhaustion that doesn't make sense. Constant fatigue isn't laziness. It isn't age. It isn't stress. It's your body filing a complaint. The longer you ignore it, the harder the damage becomes to reverse. Most people drink another coffee and keep going. That's the mistake. Next, frequent headaches. They're the second most ignored symptom worldwide. Most people grab a painkiller and move on. They never ask why. The World Health Organization reports that nearly half of all adults globally suffer from a headache disorder. Half. And most never get diagnosed. Here's what's actually happening. Most chronic headaches are tension type, caused by muscle stiffness, screen strain, or dehydration. But a significant percentage are something far worse. Migraines affect over 1 billion people globally. They're not just bad headaches. They're a neurological disease. Studies link chronic migraine to a higher risk of stroke, especially in women under 45. Then there's high blood pressure. Hypertensive headaches typically wake you up in the morning, throb at the back of your head, and won't go away with painkillers. The CDC estimates that nearly half of American adults have high blood pressure. Most don't feel it until it's too late. Brain tumors are rare, but research shows that nearly half of brain tumor patients experience headaches as a primary symptom. The warning signs are specific. A new type of headache you've never had before. Headaches that wake you up at night. Headaches with vomiting, vision changes, or weakness on one side of the body. These are not migraines. These are emergencies. Painkillers don't fix the cause. They just silence the alarm. The longer the alarm rings without action, the more dangerous what's behind it becomes. A headache isn't always just a headache. Sometimes it's your brain asking for help. Next, persistent bloating and stomach pain. It's one of the most misdiagnosed symptoms in medicine. Women are told it's stress. Men are told it's diet. Most people are told nothing at all. But persistent bloating, meaning bloating that lasts more than 2 weeks, is one of the earliest warning signs of ovarian cancer. Research from Target Ovarian Cancer found that only 1 in 5 women can identify persistent bloating as a cancer symptom. Most blame their food. They cut gluten. They take probiotics. They wait. By the time they see a doctor, the cancer is already in stage 3. A landmark study found that women with ovarian cancer are 3.6 times more likely to feel persistently bloated than women without it. The bloating happens because of ascites, fluid building up in the abdomen as tumors grow. But ovarian cancer isn't the only threat. Chronic bloating can also signal colorectal cancer, especially when paired with changes in bowel habits or rectal bleeding. Colorectal cancer is now rising sharply in adults under 50. The American Cancer Society reports that early onset cases have nearly doubled in 2 decades. Then there's irritable bowel syndrome, lactose intolerance, gluten sensitivity, and SIBO, small intestinal bacterial overgrowth. All cause bloating. All require diagnosis. If your stomach is swollen for more than 2 weeks, that's not food. That's a flag. The doctor's office is a far better answer than another bottle of probiotics. A bloated belly can be the only warning sign of a disease that kills silently. Next, brain fog. It feels harmless. It isn't. You forget words mid-sentence. You walk into a room and forget why. You read a paragraph 3 times and still don't absorb it. People call it stress. They blame their phone. They blame their age. But persistent brain fog is a measurable neurological symptom, and in many cases, it's the first sign of something serious. The first cause is chronic sleep deprivation. Your brain clears toxic proteins, including beta amyloid, only during deep sleep. Beta amyloid is the protein that builds up in Alzheimer's disease. When you don't sleep, those toxins accumulate year after year. The second cause is hormonal change. Women in perimenopause and menopause report severe brain fog due to dropping estrogen levels. Estrogen protects brain cells. When it drops, cognition drops with it. The third cause is long COVID. Multiple studies have documented persistent cognitive impairment in COVID survivors, sometimes lasting more than 2 years after infection. Brain scans show actual reduced blood flow in affected regions, but the most concerning cause is early dementia. Doctors are now diagnosing cognitive decline in people in their 40s and 50s. Brain fog that worsens over months, combined with forgetting names, getting lost in familiar places, or struggling to manage daily tasks, is not normal aging. It's a warning. Low blood flow to the brain is the #1 predictor of Alzheimer's, and it shows up first as fog. Most people ignore it because they can still function. That's exactly why it grows. Next, joint pain. It's treated like an inevitable part of getting older. It isn't. And ignoring it is one of the most expensive mistakes a person can make. Osteoarthritis is the most common cause. The cartilage between your bones wears down. Bone grinds on bone. The CDC reports that nearly 60 million Americans have arthritis. Most start the pain in their 40s and ignore it for a decade. But here's where it gets dangerous. Rheumatoid arthritis is an autoimmune disease where your immune system attacks your own joints. Without treatment, it deforms hands, fingers, and feet permanently within 5 years. Early treatment can stop the disease almost completely. Late treatment cannot reverse it. Then there's gout, caused by uric acid crystals forming inside the joint, usually the big toe. Gout attacks are agonizing, and recurring gout is linked to kidney disease and heart disease. Lupus, Lyme disease, and psoriatic arthritis all start with joint pain too. Most patients spend years being told they have regular wear and tear before getting properly diagnosed. The most ignored sign is morning stiffness, lasting more than 30 minutes. Stiffness that improves with movement. Joints that swell, redden, or feel hot. These are not aging. These are inflammation. And inflammation never sits still. It spreads. Joint damage is permanent once it starts. The window to stop the damage is narrow, and it closes quietly. People take painkillers for years before getting a diagnosis. By then, the joints are already destroyed. Next, skin changes. Your skin is the largest organ in your body. It's also the loudest. When something is wrong inside, it shows up on the surface first. Most people don't read the signs. The most ignored is yellowing skin and eyes, called jaundice. It means your liver is failing. Bilirubin, a yellow waste product, is building up in your blood because your liver can't process it. Liver disease often shows no symptoms until this stage. By the time the skin turns yellow, damage is severe. Then there's sudden dark patches around the neck, armpits, or groin, called acanthosis nigricans. It's a velvety dark thickening of the skin. It's a strong warning sign of insulin resistance and type 2 diabetes, often appearing years before a blood sugar diagnosis. Skin cancer is the most common cancer in the world. The American Academy of Dermatology reports that 1 in 5 Americans will develop skin cancer in their lifetime. Most cases are detected late because people ignore moles that change, grow, or bleed. The ABCDE rule saves lives. Asymmetry, border irregularity, color variation, diameter over 6 millimeters, evolving over time. Any one of these, see a dermatologist. Persistent rashes can signal lupus, celiac disease, or thyroid disorders. Sudden bruising without injury can mean leukemia or liver failure. Itchy skin with no rash can be a sign of Hodgkin's lymphoma. Your skin is a billboard for your internal health. Every change is information. Most people scroll past their own warning signs in the mirror. Next, sleep problems. They're not a lifestyle issue, they're a medical issue, And research now treats chronic poor sleep as a disease driver as serious as smoking. Adults need 7 to 9 hours per night. The CDC reports that 1 in 3 adults consistently get less than that. The damage compounds silently. Insomnia, trouble falling or staying asleep, is linked to a 45% higher risk of cardiovascular disease. Studies show insomniacs have measurably higher rates of heart attack, stroke, and early death. Sleep apnea is even more dangerous. As mentioned earlier, it kills oxygen flow to the brain hundreds of times per night. People with severe untreated sleep apnea have a 5 times higher risk of dying from heart disease. Most have no idea they have it, but the symptom most people ignore is waking up between 3 and 5 a.m., unable to fall back asleep. This pattern is strongly linked to chronic stress, elevated cortisol, and early-stage anxiety disorders. It's also a major sign of hormonal imbalance, particularly in women approaching menopause. Then there's restless leg syndrome, iron deficiency, nighttime acid reflux, depression. All disrupt sleep, all worsen if ignored. The deadliest part is what poor sleep does to your brain. As covered earlier, deep sleep clears beta amyloid plaques. Without it, those plaques accumulate. Studies have linked chronic sleep deprivation to a significantly higher risk of Alzheimer's disease. You don't catch up on sleep on weekends. The damage compounds nightly, and the body keeps the receipts. Next, sudden weight changes. It's the symptom doctors take most seriously, and the symptom patients ignore the most. Unexplained weight loss of more than 5% of your body weight in 6 to 12 months is a major red flag. The American Cancer Society lists it as one of the earliest signs of multiple cancers, including pancreatic, lung, esophageal, and stomach cancer. Pancreatic cancer is especially deadly because by the time symptoms appear, it's usually advanced. But cancer is just one cause. Hyperthyroidism speeds up your metabolism so aggressively that you lose weight even while eating more. Type 1 diabetes, especially in adults, often begins with sudden weight loss as cells starve from lack of insulin. Crohn's disease, celiac disease, and chronic infections like tuberculosis all present the same way. Sudden weight gain is equally dangerous. Hypothyroidism, Cushing's syndrome, caused by excess cortisol. Heart failure, where fluid builds in the body and adds pounds in days. Polycystic ovary syndrome in women. Each one is treatable. Each one gets worse the longer it's ignored. A 2018 study published in the British Journal of General Practice found that unexplained weight loss in adults over 60 carried a cancer risk comparable to a positive cancer screening test. The risk was high enough that doctors were urged to investigate immediately. Most people celebrate sudden weight loss. They think it's progress. By the time they realize what it actually means, the diagnosis is already late. Your weight is the simplest data point your body gives you. When it changes for no reason, that's not luck. That's a warning, and it's almost never minor. The body doesn't lie. People do. To themselves.